So today we have Dr. Ray Dorsey. He's the David M. Levy Professor of Neurology and Director of the Center for Health Technology at the University of Rochester. The center seeks to provide care and research opportunities to anyone, anywhere. He received his MD and MBA at the University of Pennsylvania School of Medicine. He completed a residency in neurology at the Hospital of the University of Pennsylvania. Dr. Dorsey and his colleagues have written Ending Parkinson's Disease, a book that provides a prescription for ending this debilitating condition. He previously directed the Movement Disorders Division and Neurology Telemedicine at Johns Hopkins and worked as a consultant for McKinsey & Company. His research has been published in leading medical, neurology, and economic journals and has been featured on the National Public Radio, in the New York Times, and the Wall Street Journal. In 2015, the White House recognized him as a champion for change for Parkinson's disease. Thank you so much for giving us your time today, Dr. Dorsey. We appreciate it.
My pleasure, everyone. Please call me Ray. I'm a huge fan of the PMD Alliance. I'm excited to be with all of you today. So I'm going to, let's see, make sure I share my screen. I'm going to ask a basic question, I think, is, why do I have Parkinson's disease, or why do you have Parkinson's disease? Fortunately, I'm free of the disease, at least as of now. And this is important for two reasons. One, I think people want to know why they have a condition. And second, how can we possibly cure a disease if we don't know what its cause is? I can't think of any disease that we actually do cure with any medical intervention when we don't know the cause. So until we know the cause, I think hopes for a cure are really, really hard to realize. And I'm going to argue to you that for most people with Parkinson's disease, the reason you have Parkinson's disease is due to factors in the environment that are imminently preventable. And that if we address these, we might be able to slow the rate of progression of your Parkinson's disease, and we might be able to create a world where Parkinson's is increasingly rare, not increasingly common. So I'm going to talk to you a little bit about how Parkinson's is the world's fastest growing brain disease, which I think most of you know. Second, make an argument to you that Parkinson's disease is largely man-made, and then conclude with the hopeful message that Parkinson's disease, to the extent it's man-made, is preventable. So I'll say that again. Parkinson's disease is, I think, fundamentally preventable for the vast majority of individuals, and we need not live in a world where 1.2 million Americans have this disabling disease. So most of you know, or many of you know, that Parkinson's disease derived its name from Dr. James Parkinson's seminal description of the disease in 1817. He didn't call it Parkinson's disease. He called it an essay on the shaking palsy. A French neurologist, Jean-Martin Charcot, about 30 or 40 years later, named the disease after him. But Dr. Parkinson said a couple of things important about his description. One, he said it's rare. Two, he said this disease had not been classified in the medical literature. And three, he described 6 individuals with the disease at the height of the Industrial Revolution in the capital of the Industrial Revolution, London, England. And these 6 individuals were living among the London fog. And for those of you who have seen the TV show The Crown, or been to London itself, know that the London fog has little to do with weather and everything to do with air pollution. And that air pollution actually began in the 1700s, if not even before then, but by 1817 was thick, dense, and resembled modern day Beijing. As you can see from this picture, the woman, her husband, and her son are walking the streets and need fire for them to actually even make their way through the streets, and they have to cover their mouths because of the toxic effects of the air pollution. And as I'm going to argue to you today, there are 3 major factors tied to the Industrial Revolution: air pollution, certain pesticides, and industrial chemicals, including those used for dry cleaning, that are likely responsible for a large portion of individuals having Parkinson's disease. And Dr. Parkinson wrote his article, he said that there were 6 people he described with the condition. 200 years later, in 2017, the global burden of disease study estimated that 6 million people have the disease. So how do you go from 6 to 6 million in 200 years? That's way, way, way too fast for anything to do with genetics, and unlikely and insufficiently explained by increasing the number of older individuals and increases in life expectancy. And absent change, the number of people with Parkinson's is going to double again. So the challenge to all of us participating on this call today is to create a world where that does not happen. Our challenge is to make sure that the subsequent generation, that we do not see a doubling of Parkinson's disease. At a minimum, we see a plateau in the number of people with Parkinson's, and if anything, maybe an aspirational goal is to see that the number of people with Parkinson's a generation from today is less than it is currently. And if you look at the map of Parkinson's disease, you notice a few things. So this is a map of the rates of Parkinson's disease by country. And if you look at the legend, you'll see that there's a 5-fold variation in rates of Parkinson's disease across the world, far more than it could be explained by genetics again. Second, you'll see that areas of the world that are most industrialized, like the United States and Canada, have the highest rates of disease. Areas of the world that are least industrialized, like sub-Saharan Africa, have the lowest levels of the disease. And areas of the world undergoing the most rapid industrialization, such as China and India, have the fastest increasing rates of disease. Parkinson's is largely man-made. So what do I mean by man-made diseases? Well, the poster child for man-made disease is lung cancer. So if you look at this graph and you look at the black line, you'll notice that in the early 1900s, lung cancer in the United States almost didn't exist. I'll say that again. Lung cancer, which is, I think, is the second leading cause of cancer deaths in the United States. No, I'm sorry, the leading cause of cancer deaths, I think, in the United States, just didn't exist in the early 1900s. It was considered so rare that it was called a once-in-a-lifetime oddity. All the doctors and medical students would gather around when they saw a case of lung cancer, thinking they would never see one again. Unfortunately, they were wrong. About 25 years after cigarettes were introduced in the United States in the early 1900s, we saw a corresponding rise in the rates of lung cancer deaths. And after smoking, one of the great public health achievements in the 1970s and 60s was a curtailing of smoking, which I think at its peak accounted for 1 in every 6 deaths in the United States, 1 in every 6 deaths due to smoking. 25 years after smoking peaks, we see a peak in lung cancer deaths. As smoking rates have fallen, so have lung cancer deaths fallen. And I think the same could be true for Parkinson's disease. Indeed, Parkinson's is among the least heritable conditions. So this is a measure of the heritability of condition, going from 0, not heritable at all, to 1, perfectly heritable, like a disease like Huntington's disease, a rare genetic disease. You can see that some of the most heritable diseases are like type 1 diabetes, which tends to happen in young children, and schizophrenia. But near the bottom of it, the list is Parkinson's disease and even breast cancer. For example, breast cancer mutations BRCA1 and BRCA2 only account for 10% of people with breast cancer. 90% of people with breast cancer don't have those mutations, and breast cancer affects 1 in 8 Americans. And less than 15% of you, if I were in an auditorium, I'd ask how many of you have a family history of the disease, but my guess is that's a small minority. We've known for over 100 years that only about 15% of people with Parkinson's have a family history of the disease. And we've known based on research conducted over the last 25 years, that at most 15% of people have an identifiable genetic risk factor for Parkinson's disease. And these are some of the most common genes and genetic risk factors linked to Parkinson's disease. And you can see 2 things. 1, they're rare, in some cases really, really rare. And 2, they have all known interactions with environmental products, environmental toxicants. So I think genetics doesn't explain why people get the disease. I think it explains why people who are exposed to certain environmental factors do get the disease and why some individuals do not. I'm happy to discuss more about that later. So what are these environmental toxicants? So we talked about a little bit about air pollution. The one that has the strongest amount of evidence are certain pesticides, especially a pesticide called Paraquat. Paraquat was developed in the 1950s. It's considered the most toxic herbicide ever created. It kills the weeds that Roundup doesn't. It's been used to commit homicide and suicide. It's associated with 150% increased risk of Parkinson's disease. And over 30 countries, including China, have banned it, but the United States has not. In fact, use of the pesticide in the United States has doubled over the last 5 years, for which data are available. It's found 20 minutes from my home in upstate New York. And I suspect, based on this map, it's found close to where you live. It's used on corn, cottons, grapes, and other commonly used products. Research has implicated Paraquat in Parkinson's disease for at least a generation, but we didn't know nearly half the story until an expose by the British investigative journal called The Guardian came out with a report in October of last year based on looking at legal documents that the manufacturer of Paraquat had to file with courts based on the increasing number of lawsuits from people with Parkinson's disease who are exposed to Paraquat. If you've been exposed to Paraquat, I'd love to hear from you. You can email me at info@endingpd.org, and I'll put that in the chat, and you'll see it a little bit later in the presentation. But they looked at, the title of the article was Secret Files Suggest Chemical Giant Feared Weed Killers Linked to Parkinson's Disease. Documents seen by The Guardian detail effort to refute scientific research into Paraquat and derail the nomination of a key EPA advisor who happens to work right across the street from where I'm sitting right now at the University of Rochester. And these are just some of the highlights from the first 30 years or so of the manufacturer's actions, which continue to the present day. So in 1962, Paraquat was introduced first in the United Kingdom, followed a year later by the United States. In 1964, the company's own research found that skin exposure to Paraquat in rabbits in very high doses causes weakness and incoordination. 2 years later, this company scientists began company's research that some rats and mice given large doses of Paraquat display a stiff gait or tremors. So this research that's over 50 years old. Poisoning deaths and suicides start to rise due to Paraquat in the 1960s. State regulators in the 1970s expressed concerns about workers, quote, who might inadvertently lick small quantities of Paraquat residue off their lips or inhale Paraquat mist. Rumors circulate almost 50 years ago that some of the EPA are in favor of banning Paraquat. The EPA is yet to do so. An autopsy in 1976 of a farm worker working with Paraquat showed degenerative changes in the cells of the substantia nigra, which are the area of the brain that we know are damaged in Parkinson's disease. And in 1985, a memo reports that a scientific article showed a nearly perfect correlation between areas in Canada that had the highest rates of pesticide use and areas in Canada that had the highest rates of Parkinson's disease. The memo warns that Paraquat could become a huge legal liability and like asbestos, and said that Parkinson's can go on for decades. And indeed it has. So rather than withdraw the product, rather than introduce a safer alternative, the company doubled down on their quote blockbuster product, and in doing so have exposed thousands, if not millions, to a risk factor, if not a likely cause of Parkinson's disease. And you might be saying, how in the world does this all happen? And it happens because of a new term that my friend and English professor introduced me to called agnotology. Agnotology is the deliberate production of ignorance, often for commercial gain, classically attributed to the tobacco industry, whose slogan was "Doubt is our product." They didn't seek to prove that tobacco was safe or healthy or didn't cause lung cancer. They just seek to raise doubts and say that we need more research. We're uncertain. Some scientists, usually a very, very small fraction, are uncertain of its health effects. We should investigate more. They sought to ensure that the regulators or members of advisory committees were those that were friendly or often paid for by the industry or by its lobbying firms. This has been applied to the ozone layer, it's been applied to acid rain, it's applied to climate change. And I suggest this probably applied to other environmental toxicants that are linked to Parkinson's disease. And these actions are attacks on science, they're attacks on scientists, and they're attack on your health. And they shouldn't be tolerated. And they should not go unpunished. So that's a second major likely cause of Parkinson's disease. A third is a chemical called trichloroethylene, or TCE. It's a really simple chemical structure. It's got a total of 6 atoms, 2 carbon atoms, 1 hydrogen, and 3 chlorine atoms. Hence its name, trichloroethylene. There's a very, very similar chemical that's still used in dry cleaning called perchloroethylene, which is exactly the same chemical structure, but instead of that hydrogen atom, and it has a 5th chlorine atom. This chemical was developed it was first synthesized in 1864, so it's been around since the Civil War, and was really commercial production began in the 1920s. If you think about it, it's kind of odd that we're still using a chemical from the time shortly after the Wright brothers flew their first airplane, and when Henry Ford was still producing the Model T. I would suggest that if engineers can develop safer cars and safer airplanes, chemists can certainly come up with safer chemicals, but they've been allowed not to. This chemical is associated with a 500% increased risk of Parkinson's disease. My colleagues, Dr. Sam Goldman and Dr. Caroline Tanner at UC San Francisco, looked at twins from World War II who had a hobby or occupational exposure to TCE, and those that did had a 500% increased risk of developing Parkinson's compared to those who did not. And the time from the time of exposure to time developing the disease was between 10 and 40 years. So like cigarette smoking and lung cancer, you don't smoke a cigarette and develop lung cancer the next day or the next year or even the next decade. There's a long lag time, and which makes it really hard for people to associate a previous exposure to development of the disease. And because TCE was so widely used, it said that the potential public health implications are substantial. Beyond Parkinson's disease, TCE is known to cause cancer. According to the World Health Organization, it's carcinogenic to humans. According to the EPA, it's carcinogenic in humans by all routes of exposure. It's associated with excesses, incidences of liver cancer, kidney cancer, non-Hodgkin's lymphoma, prostate cancer, multiple myeloma, also associated with brain cancer, breast cancer, especially in men, and a whole range of other medical conditions ranging from miscarriages to babies born without brains to a wide range of autoimmune and skin disorders. I told you in the 1970s this was ubiquitous. These are a list of some of the workers that have been that are likely exposed to it: aircraft maintenance workers, computer specialists, dry cleaners, food manufacturers, jet engine mechanics. If you saw the recent Pentagon report over the weekend associating jet engine pilots or fighter pilots with increased risk of cancer, I think this might be why. Painters, printers, rubber cementers, shoemakers, taxidermists, and varnish workers. But you need not have worked with the chemical, although 10 million Americans are estimated to have done so. You could have gotten it in consumer products, everything from decaffeinated coffee. It was found in Senka in the 1970s. It was found in typewriter correction fluid. It was found in carpet cleaners and gun cleaners, inks, refrigerants, sealants, and stain removers of all different kinds. And then widely used in industry for degreasing and in military bases. Even doctors used TCE to anesthetize patients, especially pregnant women. This is a report that one of my colleagues, Dr. Victor Polshok, brought to my attention. This is from the American Journal of Obstetrics and Gynecology in 1956, saying that TCE is a potent analgesic drug. Its margin of safety and ease of administration will ultimately make it a standard agent on all delivery floors. Trilene's wide variety of uses will probably allow almost every obstetrician to find a place for it in his obstetrical practice. In 1977, the FDA banned this use. TCE is still permitted to be used by the EPA, even though the EPA found in January of this year that it poses an unreasonable risk to human health. Beyond its ongoing current use, over half of the most toxic Superfund sites in the entire country are contaminated with TCE, including one likely near you. TCE contaminates up to 30% of the groundwater in the United States. It's often inappropriately disposed of by people by either leaking from sewer lines, for example, or sometimes companies or dry cleaners or the military simply pours it into the ground and then makes its way through the soil and then gets into the underlying groundwater, forms underground plumes or rivers, which can migrate a mile or more. And because TCE readily evaporates, or it's readily volatile, it evaporates from contaminated groundwater and soil, much like radon does, and can enter people's homes, schools, and workplaces undetected. So I told you about 10 million Americans work with the chemical. I think millions more, probably an order of magnitude more, have been exposed to this through the environment. And the people who get exposed to it in the environment often never know about their exposure and would have no reason to ever associate that unknown exposure with Parkinson's disease, cancer, or any of the other many conditions that's tied to TCE. The poster child for TCE contamination, well, there are a couple of them. One is the Marine base Camp Lejeune. So many of you probably heard about this Marine base in North Carolina. Saw Captain Amy Lindbergh on this call. And when she was a lieutenant, she served at this Marine base where she outworked all of her fellow Marines, but was exposed to the water that was contaminated with TCE at levels up to 3,000 times that which were considered safe at the time. And she would drink it, and she would bathe in it, and she would cook in it. And even when she was bathing in it, because it readily evaporates when she's bathing in it, she's coming into contact with on her skin, and she's coming into contact with it as she breathes in these toxic fumes. This went on from the 1950s, 60s, 70s, and 80s, and the Marines knew about it and hid the risks for it. And that's why you're hearing a lot about it, attention about it in probably your TV shows that you watch. The state of Michigan alone is estimated to have thousands of these contaminated sites. Here's just one from an automobile manufacturer where TCE got into the groundwater and formed a mile or more long plume. So if you lived or studied or worked in a building on top of this plume, you'd be at risk for breathing in these chemicals. Any of you have seen the movie or read the book, A Civil Action, that talked about how TCE contaminated the drinking water in Woburn, Massachusetts, just outside of Boston, and caused kids in that area to develop leukemia, and the vast majority of whom died. If you're in Silicon Valley, I saw a lot of people in California. Silicon Valley is home to more Superfund sites, I think, per square mile than any other place in the country, maybe except New Jersey. There are 15 Superfund sites in Silicon Valley where it was used to clean off semiconductors along just a 7-mile stretch of the 101 freeway. Jane Horton lives across the street from 2 of these Superfund sites, which are underneath the current headquarters of Google. She had her indoor air tested, found it to have elevated levels of TCE, had a simple remediation system in, much like any of you have had a radon remediation system. It sucks the air from underneath your foundation and just vents it above your roof. I'm told that these cost between like $1,500 and $2,000. And now she has her indoor air monitor, and she says she has the cleanest indoor air in all of Mountain View, California. There are multiple of these sites in New York State. Last April, for Parkinson's Disease Awareness Month, I visited 5 Superfund sites in the state of New York in just 3 days. And for those who've never seen a Superfund site, they're actually remarkably nondescript. This is a picture of one in Nassau, New York, where a person who ran a dump actually had people dumping some of the toxic waste that he was trucking in his own yard. And as you can see, this is a pond where he used to live, and he's since passed, but I think his wife still lives there. There's no fence, there's no hazmat suit, there's no notice, there's no public warning signs or anything. Actually, right next to this pond is a little path where I saw a little girl bicycling on her bicycle with her training wheels, and I saw families living, within 50 yards or 100 yards of this super fun site that's contaminated with TCE. I'm not immune to it either. There are at least a dozen dry cleaning sites that are contaminated with TCE or perchloroethylene, that other dry cleaning chemical within the Monroe County where I live. 3 of these dry cleaning sites are within about 5 to 10 minute drive of my home. And I found that even where I went to high school in Newport Beach, California, is home to one of the largest residential contaminations of TCE in the entire state, if not the entire country, where over 400 homes live on top of a former aerospace facility. And at least 100 of those homes have elevated levels of TCE and PCE in them. And at least dozens of them are thought to be due to the plume on which they're living on top of. The toxicity of trichloroethylene is not new. I'll read you this letter to the editor from JAMA by Dr. Kerry McCord from my hometown of Cincinnati, Ohio. And he said that promotional activities seeking the extension of industrial uses of trichloroethylene frequently fail to disclose the toxic nature of this chemical and the practical dangers that may attend its use. He then applied the TCE to the skin of rabbits, and they died in weeks, if not days. And he had rabbits inhale it, he said, often in trivial amounts, and they died in days, if not hours. He concludes his letter to JAMA by saying that any manufacturer contemplating the use of trichloroethylene may find in it many desirable qualities. 2, in the absence of closed systems of operation, he may find in this solvent the source of disaster for exposed workmen. He wrote this in 1932. So where's the silver lining? Where's the sunny skies out of this? To the extent Parkinson's disease is man-made, I think it's a preventable disease. And we have lots of other preventable diseases that we no longer have. We live in a world that's free of typhus. We live in a world free of smallpox. We live in a world where polio is incredibly rare. We live in a world where lots of diseases like scrotal cancer simply do not occur because we figured out what their cause was. In many cases, either an infectious agent or some cases an environmental toxicant, like as for cancer of the scrotum, and we've gotten rid of them. And when we've gotten rid of them, we've seen these diseases disappear. And the same could actually happen for Parkinson's disease. And there's actually reason to think that this is possible. About the only study in the entire world that I know of that showed that the number of individuals getting diagnosed with Parkinson's disease adjusted for age has decreased is in the Netherlands, where they found between 1990 and 2000, almost a 40 to 50% decrease in the number of new cases of Parkinson's disease. And if you look back and you look at these 3 environmental risk factors, air pollution, pesticides, and trichloroethylene, you see substantial reductions in those. Air pollution in the Netherlands decreased by more than 50% between 1990 and 2012. The levels of pesticides in people's fat were found to have dropped between 75 and 90% in just 18 years. In 1981, trichloroethylene levels in Europe were among the lowest, in the Netherlands were among the lowest in all of Europe. And most of the EU banned TCE in about 2016. So if we address air pollution, if we address pesticides, if we address trichloroethylene, we can see in actually relatively short periods of time, substantial reductions in the rates of Parkinson's disease. More research needs to be done clearly here, but clearly the promise of a world where Parkinson's disease is increasingly rare. In our book, Ending Parkinson's Disease, we outline a PACT, P-A-C-T, to end the disease. And the first step to doing that is to prevent the disease, which we can do by banning Paraquat and trichloroethylene. The Department of Justice remanded to the EPA to re-review Paraquat. The EPA has determined that both trichloroethylene and perchloroethylene pose an unreasonable risk to human health. It is time for us to make sure that our legislators force the EPA to act to ban it. Senator Cory Booker has introduced a bill to ban Paraquat, and we should support those efforts. We also need to make our voices heard. The only reason that these chemicals are allowed to remain on the market is because the chemical companies make their voices heard. They meet with representatives and senators. They hold meetings for staffers to learn their perspective. their perspective on these chemicals, and you've now seen some of the evidence of what the manufacturer of Paraquat has done. Just think about what other manufacturers of other toxicants are likely doing. Third element of the pact is C for care. We need to care for everyone that's affected with the disease. One of the silver linings of the COVID-19 pandemic was increased adoption of telemedicine, a 100-fold increase in use of telemedicine among Medicare beneficiaries. That coverage by Medicare telemedicine is temporary. If you're receiving care in your home, if you're receiving your care in an area that's not classified as a health professional shortage area, that benefit could go away. Be sure to tell your representative and senator to make Medicare's coverage of telemedicine permanent. And finally, we need better treatments for those people who currently already have the disease, like all of you. We've had more therapeutic breakthroughs for Parkinson's disease last century than we've had this century. Parkinson's disease research is woefully underfunded. NIH spends only about $250 million on research related to the disease. By contrast, Medicare spends 100 times more, $25 billion a year, caring for people with the disease. I suspect most of us would much rather have more research be aimed at preventing and treating Parkinson's disease and less on caring for the disease. So what should you all do? One, you need to hold wrongdoers accountable. If we do not hold wrongdoers accountable, if we don't hold the tobacco industry accountable, if we don't hold the manufacturers of chlorofluorocarbons, which destroy the ozone layer and led to skin cancer, if we don't hold pesticide manufacturers accountable, if we don't hold people who are polluting our air, water, and our food accountable, they will only feel emboldened. They'll only continue to act. You need to ask questions and demand action. Second, we need to ban Paraquat, trichloroethylene, and perchloroethylene at the federal level. Third, you can read Ending Parkinson's Disease. It's available on Amazon. It's available in your library. It's available on lots of different booksellers. All the authors are donating all of our proceeds to efforts to end Parkinson's disease. If you can't afford a copy, just email me at info@endingpd.org, info@endingpd.org, and I'll send you one for free. Just give me your mailing address. Fourth, if you haven't joined the PD Avengers, please do so. The PD Avengers is free to join. It's a global grassroots organization formed by 3 individuals with Parkinson's disease, and it's run and led and managed by people with the disease. It's the only global grassroots organization of its kind for Parkinson's disease. We need to make our voices heard to change the course of this disease. And then finally, I'd love to hear your stories. I learned so much from them. If you've worked with Paraquat or trichloroethylene or have additional thoughts or suggestions, please let me know. I'm all ears. I read everything that comes in. You can email me at info@endingpd.org. With that, I'm happy to take any questions that you have. Thanks very much.
Thank you. We have put some links in the chat, so I do encourage everyone to save their chat. If you have your chat open, there's 3 little buttons you can click on, and more will appear and you can save your chat. You don't need to do it right now, but we did put info@endingpd.org. We put the information for PD Avengers. We put information on the TCE study, as well as the link to the book. So I definitely encourage you to save your chat. We do have some questions. So the first question, because you talked about the growing rates, someone asked, isn't it possible that the increasing prevalence is due to the increase in ability to diagnose? For instance, medical care in Africa is low, therefore PD is not diagnosed as much.
Well, it's possible, but if you look at the rates of diagnosis for other diseases like multiple sclerosis and stroke, for which we are actually fundamentally much better at diagnosing than we were like 25 years ago, some of those rates of stroke, for example, are decreasing. So I think it's possible, but I don't think it's likely.
Okay. And then someone asked about, what about heavy metals and forever plastics, PFAS?
Yeah, so PFAS, I just haven't seen much research on Parkinson's and PFAS, so I'm not sure. So heavy metals, I think, is more concerning. So we know that manganese exposure, for example, one heavy metal is associated with Parkinson's disease. I actually think that might be why Pope John Paul II developed Parkinson's disease. He used to work in a manganese-rich quarry during World War II. Happy to discuss that another time. But if you look at air pollution, so when you look at smog, you guys can see like, there's something in the air, right? If you look in Los Angeles, there's something in the air, and the air is little pieces of dirt and soot. And most of those pieces of dirt and soot, we either sneeze out or we cough out. But some of those pieces of dirt and soot are really small, and so they go up directly into our nerve that's responsible for our smell, and then they go back to the part of the brain that's called the olfactory bulb or the smell center, and then spread to different parts of the brain. But hitchhiking on those little pieces of dirt and soot are toxic metals: lead from leaded gasoline, platinum from catalytic converters, and iron from brakes. And those things may be causing the misfolding of a protein called alpha-synuclein that's responsible for Parkinson's, or be causing the misfolding of another protein called beta amyloid that might be responsible for Alzheimer's disease. So I think for Parkinson's, air pollution and heavy metals is probably plays a small but important factor for a large number of people. But I think the story about air pollution and Alzheimer's disease is especially concerning.
And then somebody asked if you could provide a list of foods in the United States with the highest amount of paraquat use. Yeah,
so I will do it right now. So if you, the one nice thing is that the United States, we have, thanks to the efforts of many people, we have some good public databases that let you answer these types of questions. So the U.S. Geological Survey has a map of pesticides, and you can even pick your pesticide. So you can, you can see my screen. Good. Mm-hmm. So you can like select your pesticide. I selected Paraquat, and I think the most recent data they have is 2018. So this is the map I showed you showing the use of Paraquat. I didn't tell you, but like one of the areas of the country that the highest rates of Parkinson's is in Central California, right, where Paraquat is used. And here's the data showing that Paraquat use has doubled. And so you can find it on corn, soybeans, cotton, and orchards and grapes. So those are the most common uses of it. And you can do this for any pesticide that you want, if you want to see like DDT. I don't know if they still have DDT in here. Atrazine is another terrible pesticide, hopefully been banned, but this is another pesticide linked to Parkinson's disease that is still used on corn. Unbelievable. My wife says not to be so negative, so I'll just stay out.
What about somebody asked, can anything be done to reverse the effects?
Yeah, so I think a couple of things. One, I think you're going to make sure that you don't continue to get exposed. So if I had, by the time someone gets Parkinson's, 60% of the nerve cells that produce dopamine in the brain have died. So you need to protect those other 40%. Exercise is one great way to do it, but you got to make sure you're not getting exposed to additional nerve toxins. So if I had Parkinson's, I'd be really concerned about the food I eat. I'm really concerned about the food I eat. I buy organic wherever possible. I wash all my fruits and vegetables with water and a pesticide wash. I put a carbon filter in my water to decrease my exposure to pesticides and chemicals that could still be in my water. If I lived in a polluted area with high air pollution, I'd get an air purifier. This hasn't been studied at all, but I would get an air purifier for my home, workplace, and obviously you have it in your car. And when you go through traffic, roll up your windows and circulate the air. None of these things are talked about. None of them have been investigated. I think all of them are really powerful. If I got my water from a private well, like up to 40 million Americans do, I'd make sure it's tested. And when your well is tested for water, it's usually tested for bacteria. It's not often tested for pesticides and almost never tested for TCE. And if I live near a dry cleaning site, if I live near an industrial site, if I live near a military site, I'd have my indoor air tested for TCE, or if I worked in such an area. The more I've looked into TCE, the more concerned I get. And I'll just say this, you guys might think I'm like a radical guy, like crazy. Before I wrote this book, I thought the water I drank, the food I ate, and the air I breathed was clean. I thought it was safe. Now I don't believe that at all.
We have a question about, are there other toxic exposures that should be listed under prevention?
I think these are the big ones. We alluded to manganese and some of the heavy metals. So all these ones I've talked about, the certain pesticides, TCE and PCE and air pollution, they all share a common factor, that they are all damage the energy producing parts of cells called the mitochondria that we know are damaged in Parkinson's disease. So they all damage the energy producing parts of cell that they are known to be damaged. They're also all inhaled. And I think when you inhale things, that's a nice direct pathway to the nose. It bypasses the normal blood-brain barrier. It largely bypasses the liver and its detoxing capacity. So I think there are some common themes for these environmental toxins that we should just pay attention to. Now, there could be other things that damage energy-producing parts of cells, but those are the things I'd be worried about: environmental toxins that are inhaled and that damage the mitochondria. Nerve cells are among the most energy-dependent cells in the entire body. I think that's why they're so susceptible to injury.
We have a question. Are there tests to find out if we've been exposed to these contaminants, or could you get a test for your home exposure to TCE?
Yeah, so TCE you can test in the home. I've been hammering my engineering friends to figure this all out. I'm just a neurologist. I'm not a toxicologist. I knew nothing about dry cleaning until I started investigating it. So radon you can test for it in your homes. Many of you have had your radon tested. We've had radon tested in our home at some point in time. And so you can get testing for TCE, and we talked about testing for well water. Now, to my knowledge, there are no tests to evaluate whether you had been exposed to TCE in the past. They take a measure in your blood and TCE in your blood and see if I've been exposed because it's rapidly metabolized. And a study in Italy showed that 3/4 of, I think they looked at just men, but 3/4 of the general population had TCE in their urine. So just to give you a sense of like how common it was. And then for pesticides, I mentioned that people have looked at pesticides in fat and found it, but I'm unaware of any research that's ongoing that's looking at it. I think might be a missed opportunity. It'd be great to look at levels of TCE or certain pesticides and look at people with Parkinson's versus people without Parkinson's disease and see if there are differences. I think that would help us determine some of the important causes of Parkinson's. And then one other thing I'll just say on the causes, I think for rural areas, I think pesticides are likely the most important issue. And then for urban areas, those of you who didn't live and grow up on a farm, for example, I think air pollution and TCE are the most likely environmental contributors to disease.
And somebody asked about recreational drugs as far as any relationship between marijuana and cocaine.
Not that I know of. So the real breakthrough for looking at environmental causes of Parkinson's came from recreational drug use. In 1987, Dr. Bill Langston in Santa Clara Valley Hospital got called by the residents to come see a young man in his 30s, I believe, who developed acute onset, sudden onset of what looked like Parkinson's disease. And it turned out that people had been making their own heroin, and one of the contaminants of heroin was this chemical called MPTP that was later showed to destroy dopamine-producing nerve cells in the brain. Turns out that Paraquat and MPTP have a near identical chemical structure, and that's led to a wealth of research in it. We discuss all these stories in lay terms in our book. So if you want lay explanations and storytelling, with the science and sitting in the background, that's what the book talks about.
And then somebody said one of your early slides mentioned Rodinone as a correlation to Parkinson's disease. Can you please discuss this correlation? Yeah,
so Rodinone is not, I think it's more than correlation. So Rodinone, synthetic man-made pesticides were largely introduced in World War II and really saw their use climb in the 1950s and 60s and were the subject of Rachel Carson's book, Silent Spring, talking about the indiscriminate use of pesticides. Rodinone, by contrast, is made by plants. So you can imagine if you're a plant, you don't want to get eaten by insects. So many plants produce their own insecticides to kill off any insects. Rodinone is one of them. And research done by Dr. Todd Scher and Dr. Tim Greenemeyer, Todd Scher's at the Michael J. Fox Foundation, and their colleagues showed that chronic exposure to Rodinone reproduces the features of Parkinson's disease in laboratory animals. And Rodinone, too, is associated with 150% increased risk of Parkinson's disease. So be careful about using Rodinone, even though it's a natural pesticide.
And then we did get a question about how Agent Orange relates to, do the exposure relates to Parkinson's?
So Eden was telling me beforehand this is going to be coming up. So the late General Colin Powell had 2 tours of duty in Vietnam, and one of those tours of duty, at least, he was using Agent Purple, which is a more concentrated form of Agent Orange. And General Colin Powell, as some of you know, had Parkinson's disease and multiple myeloma. Both those diseases have been linked to Agent Orange. So I think veterans who worked with Agent Orange are at higher risk for developing Parkinson's disease. Despite numerous calls for them to do so, the government has really done minimal, if any, experiments publicly known studying the effects of Agent Orange on Parkinson's disease. But veterans who've been exposed to it and have Parkinson's disease is considered to be a presumptive condition related to the service.
And we had a question about the interaction of EMF, 5G, Wi-Fi with nerve damage. Has that been linked in any way?
Say it again. What was it?
Question about link of electricity, looking at 5G, Wi-Fi.
I'm not aware of any research. I think the thing that we're looking for is again these things that damage the mitochondria, the energy producing parts of cells, and I'm unaware of any studies looking at 5G and rates of Parkinson's disease. But if someone knows stuff, I'm always happy to learn.
And then somebody kind of asked specifically, like, well, how does the Parkinson's disease happen? Do we breathe in the toxins with the nose as the gateway and we kill our cells in the substantia nigra? Like, how do they bind to our DNA or proteins? How does this happen?
Colleagues, I want to know exactly that. So I'll give you 2 ideas, again, from a neurologist, a clinician, not someone who's in the lab. One, I think these environmental toxins enter into the nose or perhaps through the gut or perhaps both, can gain access to the brain. I'll stick on the nose for a second, and can lead to misfolding of this protein called alpha-synuclein. And when alpha-synuclein misfolds, we know that that misfolding can spread from nerve cell to nerve cell to nerve cell. So you can go from the smell center of the brain to another nerve center to the substantia nigra 2 steps away. Or you can then eventually from the substantia nigra, get to the higher parts of the brain, like that are responsible for thinking. So we think this spread is tied to the development of symptoms. So many of you know, like one of the first earliest symptoms of Parkinson's is loss of smell. Then people develop trouble sleeping, for example, or constipation, which is affected by the brainstem. Then later they get the tremor. Then later they get troubles with memory. Then later they get troubles with hallucination. So we think that this pathological spread of the disease within the brain correlates with the symptoms and manifestations that people have. Other thought is, and again, I don't know, is that these things are inhaled, and research done by Dr. Debbie Corey-Schlechte, the scientist that the Paraquat manufacturers sought to discredit it and actually successfully kept off an EPA advisory panel and had one of their own scientists on it instead. So think about that. The EPA declined to have an academic researcher on a panel, but had one that was favorable to industry, and I think whose interests are being served. She has shown that when rats or mice inhale Paraquat, it makes its way all the way back to the substantia nigra. So it's possible that these chemicals are inhaled and go all the way back to the parts of the brain and perhaps damage those brain cells, which are chock full of mitochondria. So the nerve cells in the substantia nigra have 1 million different connections. And if you stretched out that nerve cell, it would be 4 meters long, which is twice as big as I am. So you can imagine if you had a 4 meter long nerve cell, you got to have lots and lots of little engines producing energy to keep that nerve cell alive. And so those are 2 thoughts, but I'm open to someone to tell me otherwise.
We have somebody very concerned, wondering if wine contains Paraquat because of the grapes.
Yeah, so there was a study done in France, 2 studies in France. One looked at vineyards and pesticide use, and they found that almost again a perfect correlation between rates of pesticide use in different vineyards in France and rates of Parkinson's. Again, almost a perfect correlation, almost just like the 1987 study in Canada. The French care about their wines, and so basically something what's the little consumer magazine in the United States that ranks cars and safety stuff. Consumer Reports. The Consumer Reports of France looked at wine, and they found pesticide residues, I think, in like 97% of the wines that they tested, including organic wines, although in much lower concentrations. I didn't see a report specifically of Paraquat, but unfortunately, the wine that you drink likely has pesticides in it.
And then this was an interesting question. Is there a correlation between long married spouses and prevalence of Parkinson's, as presumably they have the same environmental, although not occupational exposure?
So our long married spouses and things. So I don't know. I don't know if that has been studied. And indeed, as the suggestions, as the question suggests, spouses share the same environment. I think that it's important when exposure occurs. I think exposures that happen early in childhood, perhaps in utero, you can even find pesticides and TCE in breast milk. I think early childhood exposures might be most important. We wrote in our paper on TCE that Brian Grant, the former NBA basketball player, was a 3-year-old boy when he lived at Camp Lejeune, where his father, a Marine, was stationed, and was exposed, very likely exposed to the high levels of TCE in the water he was drinking. So I think it's early childhood exposure that's maybe more important. But I think I would not be surprised. Someone just emailed me the other day talking about 2 sisters who lived in an area that was contaminated with TCE, and one developed cancer and one developed Parkinson's disease. We don't have a good explanation for why some people exposed to these chemicals develop the disease and why some don't. I suggested some genetic factors. I suggest environmental factors like head trauma could be chance. It's worth noting that only 10% of smokers get lung cancer, right? And we don't have, at least I don't have a good explanation for why only 10% of smokers get lung cancer, and some get heart disease, and some get other cancers, and some get emphysema, and some get heart attacks. I don't know, and I don't know that we have a good answer for why that is. We think there are some genetic differences in how people metabolize these toxicants, for example, that are likely implicated in why some people develop the disease and why they don't.
And then someone asked, basically, probably everyone on here has some incidental exposure to these. Is there a threshold for exposure where it's meaningful, or are these things unsafe at any level? Like, for example, if you lived in that Central Valley in California in a farming area for a year, is that the same as living there for decades?
We don't know, but I think the evidence suggests that one of the big scientific principles is dose response. The higher dose, the more likelihood of response. We know, for example, in California on the pesticide thing, that farmers are 150% increased risk for developing Parkinson's. People who live in the rural areas but aren't farmers are like 75% increased risk, and they could be at increased risk. Either they're inhaling the pesticides that are being sprayed, or they're drinking pesticide contaminated groundwater and well water that's not been tested or people are unaware of. So I think there's a dose response relationship, and I think occupational environmental exposure are more important than incidental use of consumer products. For Parkinson's disease, I think that's likely true. I don't have a really good sense for other diseases, but again, not been studied.
And we have a question about, because speaking of carcinogens and stuff, how come people who have smoked their whole life are reported to be less likely to get Parkinson's disease?
So I'll tell you what, I've been, Jeff Bronstein at UCLA, I think this might be a case of reverse causation. So many of you know that Parkinson's plays out for years, if not decades. And Parkinson's decreases the amount of dopamine in the brain, which is responsible for reward. And it turns out smokers who have prodromal features or early undiagnosed Parkinson's disease may find it easier to quit smoking or get less of a reward for it. There is evidence that people with Parkinson's find it easier to quit smoking, for example. So I think it might be a reverse causation as opposed to any actual benefits of smoking. It just might be easier to give up habits. If you think about the flip side, when we give people synthetic or fake dopamine, we get them to develop impulse control disorders like impulsive gambling, sexual behavior, eating, and shopping. Dr. Bronstein has convinced me that this might be a thing of reverse causation, that the disease itself makes you less likely to smoke, as opposed to smoking making you less likely to get Parkinson's.
And then there's a question about, is there any information on stem cells to replace lost that have been damaged or lost to Parkinson's disease?
Yes, about 20 years ago, they transplanted fetal cells, brain cells that had dopamine into the brains of people with Parkinson's disease, largely unsuccessful. There are efforts to do that again, hopefully with better results. And that could make a difference for a lot of people with disease. It tells you about the extreme measures that we're taking to treat people with the disease that might be fundamentally preventable.
And then somebody asked, can we detox or chelate these toxins that we've been exposed to?
So there was a study in published in New England Journal of Medicine where they tried to get iron out of the brain. We know iron levels in the brains of people with Parkinson's are higher than those that weren't. That study failed miserably. It actually made people worse. They had worsening of their Parkinson's and more side effects from the medication. So right now, the answer to that is no.
Someone said you had mentioned head trauma. Is this a separate cause of Parkinson's disease or also linked to toxins as an increased risk?
So we know there's a synergistic effect between head trauma and many environmental exposures, including pesticides. When you give them both to laboratory animals, they're even more likely to get the disease than just adding the effects together. And we know that head trauma in some individuals, Dr. Michael Oken, a co-author on this book, wrote a nice paper detailing Muhammad Ali's likely cause for his Parkinson's disease. So head trauma is important, but I suspect like most people with Parkinson's haven't had significant head trauma. So I just don't think it's as common, for example, but I think it's an important contributing factor.
And then we've got time for one more question. In animal models with TCE-induced Parkinson's disease, have any interventions allowed new neuronal development in the substantia nigra?
Yeah, so if you give laboratory animals Parkinson's by giving them environmental toxicants like TCE or pesticides, can you treat them and make them get better? That's a great question. I don't have an answer to it. I'm going to ask my colleagues next time I talk to them. They've tested lots of different medicines to try to do that, and some of those, been tested in humans, and some have made it their way to the market. But like specifically to TCE, I don't know it. It's worth noting that almost no research is aimed at preventing the disease. A back of the envelope calculation is that only 2 cents out of every research dollar focused on Parkinson's disease goes to preventing the disease. So we can't answer a lot of the great questions you're asking because simply no one's done the research. There are, in the entire world's literature, there's 27 papers on TCE and Parkinson's disease. And there's more papers published on fungus every year, every month than there have been on TCE and Parkinson's.
We are out of time. Again, I really encourage everyone to save their chat. We put a lot of information in the chat. So I really encourage you to go down to the chat, click on those 3 little dots and save your chat so that you don't lose any of this really great information and these links and such. We have a tradition at PMD Alliance, our wave of gratitude. We really appreciate your time today, Dr. Dorsey, Ray, answering all of the questions because you had a lot and you just did awesome. So thank you so much. And I hope everyone has a great rest of their day.
Thank you all. And remember, we can create a world where Parkinson's is increasingly rare, not common. That should be the hopeful, and that should be the challenge to all of us. We live in a world that's largely free of polio, where HIV is preventable and treatable, and where drinking and driving is socially unacceptable. Those are gifts we inherited from previous generations. We should reciprocate and create a world where Parkinson's disease is a rare disease again, like it was with Dr. Parkinson.